Before you reach for your usual drink tonight, I want you to pause for just a moment, because what you choose to drink before bed may be quietly raising your blood pressure while you sleep. Most people believe that nighttime is when the body finally gets a chance to rest. And in many ways, that's true. But for millions of older adults, something very different is happening beneath the surface. Instead of recovering, their cardiovascular system may still be under stress, sometimes even more than during the day. The problem is, you don't feel it happening. There's no warning signal, no sudden pain. What you notice instead is the result the next morning. You wake up feeling tired, maybe with a slight headache, or you check your blood pressure and see numbers that don't quite make sense. The surprising part is that one of the biggest triggers isn't a serious illness. It's a simple, everyday habit, something many people do without thinking. And tonight, we're going to uncover exactly what that is and what you can do about it. To understand why this matters, we need to start with what your body is supposed to do at night. Under normal conditions, your body follows a natural rhythm. As you fall asleep, your nervous system begins to slow things down. Your heart rate decreases, your blood vessels relax, and your blood pressure gradually drops. This process is known as nocturnal dipping, and it plays a vital role in maintaining cardiovascular health. It's essentially your body's way of giving your heart a break after a full day of activity. But here's the issue. This process doesn't always happen the way it should, especially as we get older. For many people over the age of 60, the body loses its ability to fully enter this restful state. Instead of dropping, blood pressure may stay elevated throughout the night. And when that happens consistently, the heart never truly gets a chance to recover. Over time, this silent strain begins to build, and that's where the real risk begins. This condition is often referred to as being a non-dipper, and it's far more common than most people realize. In fact, studies have shown that more than half of adults over the age of 65 fall into this category. That means there's a good chance that either you or someone close to you may already be experiencing this without knowing it. What makes this particularly concerning is that the risk isn't obvious. During the day, blood pressure readings can appear perfectly normal. Everything looks under control. But at night, the body tells a completely different story. When blood pressure fails to drop, it places continuous stress on the blood vessels and the heart. Over time, this can increase the risk of serious cardiovascular events, including stroke and heart disease. And perhaps most concerning of all, this often develops quietly, without noticeable symptoms, until it becomes something much harder to ignore. If this makes you pause for a moment, you're not alone. I'm curious, have you ever checked your blood pressure at night or early in the morning? Let me know in the comments. Your experience might help someone else realize what they've been missing. So what's really happening inside your body while you sleep? When you enter deeper stages of sleep, your brain signals your body to shift into a recovery mode. This involves your autonomic nervous system moving away from stress responses and into a more relaxed, restorative state. During this time, your heart slows down, your blood vessels widen, and your body begins to repair itself. Your kidneys also play an important role by regulating fluid levels and helping maintain balance within your system. There's a particularly important window, usually between 11 p.m. and 3 a.m., when this recovery process is at its peak. If everything is working properly, this is when your cardiovascular system gets the rest it needs. But if something interferes with this process, even something small, it can prevent your blood pressure from dropping the way it should. And that can have lasting effects over time. And this brings us to something many people overlook entirely: your evening routine. There are 3 common factors that can quietly interfere with your body's ability to lower blood pressure at night. The first is high sodium intake. Eating salty foods in the evening can cause your body to retain fluid, increasing pressure within your blood vessels. The second is dehydration. When your body doesn't have enough fluid, your blood becomes slightly thicker, forcing your heart to work harder to circulate it. And the third factor, the one most people don't think about, is what you drink before bed. Certain beverages can stimulate your nervous system, disrupt hormone balance, and prevent your body from fully entering a restful state. And when that happens, your blood pressure may stay elevated throughout the night without you even realizing it. Let me give you a real example. I worked with a 9-year-old patient whose daytime blood pressure readings looked completely normal. On paper, everything seemed fine. His doctor was satisfied with his results. But the patient kept telling me that something didn't feel right. He often woke up tired, with headaches, and felt mentally slow during the first few hours of his day. So we decided to monitor his blood pressure over a full 2-4 hour period. What we found was surprising. In the middle of the night, around 2 a.m., his blood pressure had risen to a level that would normally be considered dangerously high. While he was sleeping peacefully, his heart was under significant stress. And without that test, he never would have known. When we looked closer at his evening habits, the answer became clear. Every night he followed the same routine. He drank a strong cup of tea with sugar and then a small glass of alcohol to help him relax before bed. On the surface, this didn't seem unusual. Many people have similar habits. But in his case, these 2 drinks were working against his body. The caffeine from the tea was stimulating his system, while the alcohol was disrupting his sleep cycle. Together, they prevented his body from entering a deep, restorative state. What felt like a relaxing routine was actually keeping his cardiovascular system active when it should have been resting. And this was happening every single night. Now, let's talk about what you can do differently, starting with tart cherry juice. Tart cherries are one of the richest natural sources of melatonin, the hormone that helps regulate your sleep cycle. As we age, melatonin production naturally declines, making it harder to achieve deep, restorative sleep. By introducing a natural source of melatonin, tart cherry juice can help signal your body that it's time to rest. In addition, tart cherries contain powerful antioxidants that support blood vessel health and reduce inflammation. Together, these effects help create the right conditions for your blood pressure to drop naturally during the night. The key is to use it correctly, unsweetened and in moderation, so you gain the benefits without unnecessary sugar. Another excellent option is hibiscus tea. Hibiscus has been widely studied for its ability to support healthy blood pressure levels. It works by helping blood vessels relax, allowing blood to flow more easily through the body. This reduces the pressure placed on the arterial walls and supports overall cardiovascular health. What makes hibiscus especially interesting is that its effect is similar to certain medications, but achieved through natural compounds. When consumed regularly, especially in the evening, it can support your body's ability to transition into a more relaxed state before sleep. Just remember to keep it simple, pure hibiscus, lightly prepared without excessive sugar. Warm milk with a small amount of nutmeg is another simple but effective option. Milk contains nutrients like calcium and tryptophan, both of which play a role in promoting relaxation and supporting healthy sleep patterns. Tryptophan, in particular, is involved in the production of serotonin and melatonin key hormones that help regulate your sleep cycle. Adding a pinch of nutmeg can enhance this calming effect. Nutmeg has natural properties that may support relaxation and help reduce stress levels. This combination creates a gentle nighttime routine that encourages your body to slow down and prepare for rest. And when your body relaxes more effectively, your blood pressure often follows. Another option that's often overlooked is water combined with magnesium. Magnesium plays an essential role in helping your blood vessels relax. It supports muscle function, including the smooth muscles that control your arteries. When magnesium levels are low, blood vessels can become more constricted, making it harder for blood to flow efficiently. By adding magnesium to your evening routine, you help support your body's natural ability to maintain healthy circulation. This can create a more favorable environment for your blood pressure to decrease during sleep. It's a simple change, but one that can make a meaningful difference over time. After making a few small adjustments, removing the tea and alcohol, and replacing them with more supportive options, my patient began to see real changes. Within a few weeks, his nighttime blood pressure readings improved significantly. When we repeated the monitoring, the difference was clear. His blood pressure had dropped closer to a healthy range during the night. But more importantly, he felt better. He woke up with more energy, fewer headaches, and a clearer mind. This wasn't the result of a major medical intervention. It came from small, consistent changes to his daily routine. This highlights something very important. Your body responds to what you do consistently. Small habits may seem insignificant in the moment, but over time, they shape how your body functions. What you drink before bed may feel like a minor detail, but it can influence your cardiovascular system for hours while you sleep. And those hours add up over time. The goal isn't perfection, it's awareness and consistency. So to keep things simple, here's what to remember. There are drinks that support your body at night, like tart cherry juice, hibiscus tea, warm milk, and magnesium water. And there are drinks that can work against you, especially those with caffeine, alcohol, or hidden stimulants. Making better choices doesn't require a complete lifestyle overhaul. It starts with small, intentional changes. So here's your action step for tonight. Take a moment to think about your current routine. What do you usually drink before bed? Now, choose just one thing to change. You don't need to do everything at once. One small adjustment is enough to begin. And over time, that small step can lead to meaningful improvements. So here's your action step for tonight. Take a moment to think about your current routine. What do you usually drink before bed? Now, choose just one thing to change. You don't need to do everything at once. One small adjustment is enough to begin. And over time, that small step can lead to meaningful improvements. Before you go, I want you to think about something simple. Most people keep waiting for the right time to take their health seriously, but that moment rarely comes on its own. Real change usually starts with one small decision repeated consistently. Tonight, take a moment to look at your routine. What are you drinking before bed, and is it helping your body or quietly working against it? Now, I'd like to hear from you. Which of these drinks are you willing to try first? Type 1 in the comments if you're ready to make a change. Or type 2 if you want to start paying closer attention to your blood pressure patterns. Your comment might not just help you, it might help someone else realize what they've been missing. And if you found this helpful, consider sharing this video with someone you care about. Because sometimes one small change at the right time can make a much bigger difference than people expect.